Carmen Laurel Pett, Estrada College, Diploma of Counselling, Practical Assessment on Person-Centred Therapy. Hi Gareth, welcome back. How have you been this week?
Yeah, good. Things have sort of happened or are moving, sort of taking a change of direction in life. Still communicating with the girls.
Yep.
Okay, I think we've got a good line of communication there.
Yep.
Talking every week, every sort of Saturday morning before they head off to their sports. And but there's been an interesting development.
Sure, tell me about that.
Well, as you know, with the work that I do, and I had to move over here, there's now rumours that, it's gone beyond rumours, that the office is going to relocate back to where the wife and the kids are in that city. So, interesting.
Interesting. So, how are you feeling about that? Do you want to tell me some more about that, or?
I'm excited. Obviously, the distance won't be a factor anymore. But there just seems to be I think just a shift in the relationship with the girls. I think where they know, the mother knows, but I'm just finding our conversations are a bit different, or the tone. There doesn't seem to be that excitement. If anything, I'm sort of perceiving a bit of fear, and I don't know what that's being based on.
Fear from the girls?
Yes, for me coming back to town.
Yeah.
When I look back, things were great prior to the announcement. We talked about visits and what have you, but now that I'm saying that I'm going to be living very close to them, there just seems to be a bit of a gap appearing.
Okay, so I'm hearing some uncertainty about where your girls are at. So you were excited about the move. It sounds like a great move, and I feel your excitement there. That I know your girls are very important to you, and being able to move back close to them. But there's another issue there too now, isn't there? There's that.
Yeah. I think.
Yeah.
From what I'm hearing, is the language that they're using is sort of, they're being conditioned in a sense,
right.
Or trained. Well, not so much trained, probably conditioned, and I don't know whether, the mother is feeding things into their minds because they're using sort of standoffish language, and that open language that was there before is slowly disappearing. So I don't know, it's what I'm thinking or feeling, that whether the mother's planting stories or thoughts or of how we were before in their mind, that that I was much better at arm's length, which won't be the case anymore.
Okay. And how do you think it's going to go being that close?
Look, I'm excited about it. I'm looking forward to being closer. Obviously, I'll be able to have, more time with the girls as opposed to just speaking to them over the phone. But it's because I'm hearing that change in their voice. My fear is that they won't want that physical contact or interaction.
Yeah. So your fear is that they won't want to be that close with you, or
Yes.
they might feel. Is it just that they won't want to be near you, or is it a bit more than that they might feel torn, or just?
My fear is that the fear will be based on unfounded information. That's why I think where the mother may be telling them stories or telling them information about me, that they're creating these new perceptions of me, which, to what extent the content is true or not. That's where my fear is.
And that's hurtful and unfair.
Indeed.
Is that right? Yeah.
Indeed.
Yeah. Well, I am very sorry to hear that. It sounds like you've had a good relationship. You've had a good relationship with your daughters, and that dynamic changing. I can really hear that fear, and I'm sorry that that's happening to you.
Yeah, well, I think I'm confused because the mothers allow them to be on the phone to me.
Yeah.
Uninhibited, that's fine. But whether she thinks there may be an element of me taking them away from her, even if for a visit, whether that's a whole new dimension for her. And
I suppose when these things happen, sometimes the decision is between action and inaction. And do you want to think about that? Where do you feel you would like to go with this?
Yeah, well, I haven't thought about that. I will have to, certainly think about that a bit more.
Yeah, because, there's no right or wrong decision, and sometimes you have to look at what you want and what you want for your girls to determine how you can make those changes within yourself.
Well, that's right. It was 4 years since I separated and moved away, and me moving back probably happened within the next 6 months. So I think there's at least a bit of buffer for me to try and work through those other things.
Yeah, and big decisions.
Yes, indeed.
Yeah. Okay. So going forward, I suppose temporarily, as much as you've got sort of big picture stuff to think about, when you came in here to talk about, dealing with this situation, just wanted to get those feelings out, or did you have an outcome in mind for yourself?
Yeah, look, I think it was more to be able to express them, just to get them out of my head.
Yeah, sure.
I don't really know yet how they're sort of embedded within the feelings. I think the feelings at the moment are a bit mishmashed. Sure. But I just needed to just verbalise it, I think.
Yeah. Just
to get it out and take it from there. It's not so much a blame game. As I said, it's all perception. I don't know whether it's just me conjuring things up in my mind, but that's the fear I'm feeling at the moment, that things are changing, or that I've noticed a shift.
Yeah.
Whether that shift is me listening in a different way, or whether it is the girls speaking differently. Don't know yet.
Well, I've noticed in our counselling sessions together that you are perceptive, and it's good to trust yourself. I think you've got a good clear head, and trusting yourself is important, and knowing where you want to be, and in fact where you want to be with your girls is something that you'll think about and come to a conclusion on, and we can certainly talk our way through that. You say there's a bit of confusion there. There probably is, but there is fear and a bit of anxiety and a lot of love for your girls, which is really beautiful. So try and hold on to that.
Thank you. I will. And you're right. It's probably quite a lot of anxiety on my behalf.
Definitely.
Yeah.
And that can be quite scary.
Yeah.
Especially with children. Thanks for coming in and
Thank
sharing
you.
today, Gary, and we'll schedule in for next week so we can.
Yeah. That's okay.
We can.
Well, my name's Gary anyway.
Yeah.
I'm a footballer, Gary, but yeah.
So we can. We can talk through this a bit more.
Okay.
Thanks.
Thank you. Bye.
Part 2, discussion and reflection. I actually found that fairly difficult to demonstrate on video, person-centered therapy, mostly because a lot of the skills that I was using, I was feeling rather than actually speaking. My client spoke a fair bit. He didn't need heaps of prompting. And it takes a little while to get a take on where your client is at and how they're feeling, and to generate an empathetic response takes a fair bit of concentration actually. So I found it fairly difficult, and I think it will take some practice to get quicker at those skills and to get into the habit of responding in a encouraging, gentle way without being directive or without asking more questions and just letting them lead. My client just wanted to talk at this stage, and it was just sitting, listening and getting an idea of where they're at. And that listening, it's hard to show empathy and congruence and all of those things with it. I think I could have greatly improved on the congruence. I felt that I didn't give him much guidance or input, that I just did listen, and I felt very passive, and I almost didn't know too well how to lose that passivity and be helpful and resonant with him with that short amount of information. So I think congruence will be easier as you get to know your client better and you're able to get your head into the same page with them a lot. So I definitely would need to work on congruence and just really practice this technique. It's one that doesn't come very naturally to me, and I'm quite aware of that. The application of person-centered therapy for this client was good. He needed to talk, he needed some empathy, he was alone with his 2 girls and his ex-wife apart from him, so he probably needed a friend, a listener, somebody who did hold him in unconditional positive regard, because that gives him a nice base to be able to work through his feelings that are predominantly negative from. The limitation was, I felt Gareth spun his wheels a fair bit towards the end there, that he knew there was an issue, he knew he was unhappy, there was fear, there was anxiety, but there was almost no motivator to change, or he almost had the issue a little bit further away from himself and felt that it was happening but not what he could do around it. And I suppose if I was using CBT or something else, I would move him towards a goal-setting exercise and do some different questioning techniques to get a little bit more of an idea of what we could work to as a team. But I felt with the person-centered therapy that he had to lead that process, which he didn't electively do. So I suppose that was the main limitation I saw in this exercise.